7 Warning Signs of Colon Cancer, Colorectal Cancer. Hey, how are you doing? Have you ever stopped to think if your intestines are functioning properly or if there are any signs of trouble? Today, we're going to explore 7 crucial indicators that can point to colon cancer, also known as colorectal cancer. You might be wondering, why is it essential to know about this? The reason is clear: this type of cancer is among the most common and deadly, responsible for approximately 10% of all cancer-related deaths, according to data from INCA. So, being informed is vital. This video will be divided into 2 essential sections. In the first part, I'll discuss the symptoms and indicators of colorectal cancer. These are the signs you may notice and feel, indicating that something may not be right. In the second part, and perhaps the most crucial, I'll talk about prevention. I'll detail actions and dietary habits that can reduce your risk of developing this disease. Additionally, I'll discuss intestinal polyps, what to do to prevent them, and why we've seen an increase in the number of colorectal cancer cases in younger people under the age of 50. Get ready for a comprehensive video, and stay tuned until the end. Before we continue, I ask that you like and share this video. By doing so, you help spread valuable information to those who may not have easy access to doctors or hospitals. Sharing can save lives. And tell me, do you know someone who has faced colon cancer? Where in the world are you watching our video from? Share in the comments. So, what are the 7 warning signs to be aware of regarding colon cancer? Let's find out. The 7th symptom, changes in bowel habits, refers to noticeable alterations in the frequency, consistency, or ease of bowel movements. Patients may report persistent constipation or diarrhea, a sensation of incomplete evacuation, or changes in the shape of stools. These changes may be due to the growth of a tumor that affects the passage of stools or alters the normal functioning of the intestine. The 6th sign, the presence of blood in the stool, is particularly alarming. Blood can appear as red spots or a darker coloration in the stool, indicating the possibility of gastrointestinal bleeding. This bleeding is often caused by the tumor, which, as it grows, can ulcerate or invade blood vessels, leading to bleeding. To better understand, it's important to know how the large intestine is divided. It consists of 4 main parts: the cecum, where the small intestine connects to the large intestine; the colon, divided into ascending, transverse, descending, and sigmoid colon; and the rectum, ending at the anus. Colorectal cancer can develop in any of these parts, but it's more common in the colon and rectum. The question of why colon cancer would cause blood in the stool is explained by the nature of tumor growth. As the tumor grows, it can erode and invade surrounding tissues, including blood vessels. This invasion can lead to bleeding. Additionally, the tumor can cause inflammation and irritation in the intestinal mucosa, which can also result in bleeding. In advanced stages, the tumor can partially or completely block the intestine, causing more severe symptoms, including heavy bleeding. Therefore, the presence of blood in the stool, along with changes in bowel habits, should be investigated immediately. These symptoms may be indicative of colorectal cancer, especially if they persist for an extended period. Early diagnosis is essential for effective treatment and can significantly increase survival rates. The 5th symptom, abdominal pain, is a common indicator in many gastrointestinal disorders, including colon cancer. In the context of this type of cancer, pain can be caused by the growth of a tumor that partially obstructs the intestine, leading to cramps or pain. This pain can vary in intensity and location, depending on the location and size of the tumor. In some cases, the pain may be accompanied by other symptoms, such as nausea or bloating. The 4th symptom, fatigue and tiredness, may seem less specific, but it's important in the evaluation of colorectal cancer. Fatigue can result from anemia, caused by chronic blood loss, that may not be visible in the stool. This blood loss, even in small amounts, can lead to iron deficiency in the body, resulting in anemia and, consequently, widespread fatigue and weakness. If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health. The third symptom, abdominal bloating, is another sign that may be associated with colon cancer. This symptom may result from obstruction caused by the tumor, leading to the accumulation of gas and feces in the intestine. Additionally, the tumor itself can cause inflammation and irritation in the intestine, contributing to bloating. This symptom may be accompanied by a feeling of fullness, abdominal discomfort, and changes in bowel habits. It is crucial to emphasize that, although these symptoms may be indicative of colorectal cancer, they can also be caused by a variety of other less serious conditions. Therefore, it's important that any of these symptoms, especially if they persist or worsen, be investigated by a doctor. Diagnostic tests, such as colonoscopy, may be necessary to determine the exact cause of these symptoms and ensure timely and appropriate treatment. Early detection of colon cancer is vital to increase the chances of successful treatment and improve outcomes for the patient. Unexplained weight loss, which is considered the second sign of colorectal cancer, can be a concerning indicator. In many cases of cancer, including colorectal cancer, weight loss occurs without intentional changes in diet or physical activity levels. This weight loss can result from various factors associated with cancer. The tumor can consume a significant amount of the body's energy, and the disease can interfere with the body's ability to absorb nutrients properly. Additionally, the presence of a tumor can trigger systemic inflammatory responses that alter metabolism and contribute to weight loss. The first symptom, the sensation of incomplete bowel emptying, is a common complaint in patients with colon and rectal cancer. This symptom, known as tenesmus, is characterized by a persistent feeling of the need to have a bowel movement, even after a bowel movement has occurred. This symptom can be caused by the growth of a tumor in the rectum or at the end of the colon, creating an obstruction or a sensation of obstruction. Tenesmus can be quite uncomfortable and is often accompanied by other changes in bowel habits, such as alterations in frequency or consistency of stools. These symptoms, especially when occurring together or accompanied by other signs like rectal bleeding or changes in bowel habits, should be investigated by a healthcare professional. Diagnoses such as colorectal cancer are often confirmed through tests such as colonoscopy, which allows direct visualization of the inside of the colon and rectum, and biopsy of any suspicious areas. Early recognition of these symptoms and seeking medical evaluation are crucial, as the treatment of colorectal cancer in its early stages can significantly increase the chances of a positive outcome for the patient. What are intestinal polyps? Intestinal polyps are growths of tissue that form on the inner walls of the colon or rectum. They vary in size and shape and are quite common, especially in individuals over the age of 50. While most polyps are benign, some types, especially adenomatous polyps, can progress to cancer if not removed. The transformation of a polyp into cancer is a process that usually takes several years, underscoring the importance of regular colonoscopies for the early detection and removal of these polyps. When we talk about risk factors for colorectal cancer, these can be divided into non-modifiable and modifiable factors. Among the non-modifiable ones, we have age, with the risk significantly increasing after age 50, a family history of colorectal cancer or adenomatous polyps, a personal history of cancer or certain inflammatory bowel diseases such as ulcerative colitis or Crohn's disease, and certain genetic conditions such as familial adenomatous polyposis (FAP) or Lynch syndrome. On the other hand, there are lifestyle-related risk factors that are modifiable and depend on personal choices. Diet plays a crucial role. Diets rich in red and processed meats and low in fruits, vegetables, and fiber are associated with an increased risk of colorectal cancer. Additionally, smoking, excessive alcohol consumption, obesity, and lack of regular physical activity are significant risk factors. The good news is that lifestyle changes can help reduce the risk of developing colorectal cancer. This includes adopting a diet rich in fruits, vegetables, whole grains, and lean protein sources, maintaining a healthy weight, quitting smoking, limiting alcohol consumption, and staying physically active. Furthermore, participation in screening programs, such as regular colonoscopies starting at age 50 or earlier, depending on personal risk, is vital for the early detection of potentially precancerous polyps and early-stage colorectal cancer, when treatment is most effective. Therefore, while some risk factors for colorectal cancer are beyond our control, there are many preventive measures that can be taken to reduce the risk. Awareness of these factors and the adoption of a healthy lifestyle are important steps in colorectal cancer prevention. The increasing incidence of colon cancer in young individuals is a phenomenon that has drawn the attention of the medical community in recent decades. Several theories have been proposed to explain this increase, and most of them focus on changes in lifestyle and environmental factors. One of the most discussed theories is the relationship with modern diet and lifestyle. Diets high in saturated fats, red and processed meats, and low in fiber, fruits, and vegetables have been associated with an increased risk of colorectal cancer. Additionally, the rising prevalence of obesity and physical inactivity, also common in many countries, contributes to the elevated risk. These dietary and lifestyle factors can lead to changes in intestinal bacteria, microbiome, and systemic inflammatory processes in the body, which may contribute to cancer development. Another important consideration is exposure to environmental carcinogens, such as pollutants and chemicals in food and consumer products, which can have harmful effects over time. Additionally, there is growing recognition that genetic and familial factors may play a more significant role than previously thought, especially in young patients. As for protecting against colorectal cancer, it's important to adopt a healthy lifestyle. This includes a diet rich in fruits, vegetables, whole grains, and lean protein sources. Reducing the consumption of red and processed meats, maintaining a healthy body weight, and engaging in regular physical activity are key preventive measures. It is also advisable to avoid smoking and limit alcohol consumption. Furthermore, while traditional screening guidelines for colorectal cancer begin at age 50 for most people, those with a high risk, whether due to a family history, genetic conditions, or other risk factors, should start screening earlier. This screening may include tests such as colonoscopies, which can detect and allow the removal of precancerous polyps before they develop into cancer. It's important for young individuals to be aware of these risks and preventive factors. Awareness of colorectal cancer symptoms and seeking medical advice in the face of any changes in bowel habits or other related symptoms is essential. Early detection remains one of the most critical elements in increasing survival rates and ensuring positive outcomes in the treatment of colorectal cancer. So, if you liked the video, don't forget to give it a thumbs up and subscribe to the channel to continue learning how to take care of your health.